this pandemic continues to reverberate around the world, not only here in Australia and not only in Victoria, but particularly today where our hearts are with our Victorian family and friends and colleagues. So globally, almost 18 million cases now, close to 700,000 deaths. This is a huge, huge thing in terms of health disaster, a health emergency. Here in Australia, 18,318 cases now, including, sadly, 221 deaths. So 444 new cases since yesterday and 13 deaths, most of those related to aged care. We continue to have, therefore, almost 7,000 active cases. Most of those, almost all of those, are in Melbourne and other parts of Victoria, mostly in Melbourne, and a growing number of unlinked cases. So these are ones that we can't make clear connections to known clusters or outbreaks. And so these are the reasons why these new restrictions have been announced today. I can say that I had a very good and fruitful conversation with my colleague Professor Sutton on Friday night, together with Professor Murphy and also Professor Alan Cheng from Victoria, the Deputy Chief Health Officer down there. And in that conversation, they laid out exactly what they were seeing from the first 3 weeks of the lockdown in Melbourne, and considering what we knew from the modelling, and particularly that R effective number that we've talked about many times before. And that's hovering around about 1. It shows that those stage 3 lockdowns have been effective to a point, but if we were to continue in the way we're continuing in Melbourne at the moment, those large numbers that we're seeing every day would continue. On average, every person that has the infection infecting one other person. And so because that would mean that this would prolong those stage 3 lockdowns, it would prolong the issues of large numbers of cases and what we're seeing there in terms of unacceptable illness and even deaths, as well as the seeding into other jurisdictions and the rural areas of Victoria. There was a need to do something else. And so what was announced today was very proportionate and based on the general principle that the virus does not move by itself, it moves with people. And so if you decrease the movement around a city like Melbourne, you will get on top of this virus spread. Decreasing that mixing of people and that close interaction, that is the way we stop the spread. We flatten that curve by decreasing that R effective number. And I'm really convinced that this will happen. It will take time. These things always take about 2 weeks or so, sometimes longer, to show that they are effective, but this will be effective. And so it has to be, of course, related to all those other things we've talked about in terms of that personal issues of hygiene, cough etiquette, of if you're sick, stay at home. Everyone should be staying at home, particularly those who have tested positive. Seek a test if you are sick. Make sure that isolation is really taken into account. That together with the ongoing engagement and with the community, I'm sure that the Victorian authorities have done the right thing today, and the Australian Health Protection Committee is absolutely behind that.